This bill has been in the process for many months now. We've had many stakeholders at the table, from pharmacists to pharma to insurance companies to the governor's office, and we have put a lot of work into this bill. It is a very clean bill. I'm happy to say that this is what good governance actually looks like. So just as the good co-chair says, when we look at PBMs, I think many of us across the nation really are concerned with that vertical integration that we have with our healthcare insurance. What we're trying to do is we're trying to say that these pharmacy benefit managers need to have a good faith dealing when they are dealing with customers. There are things that I believe that we could have done better. When we look at spread pricing, we look at the amount of money that the PBMs charge the health insurance carrier versus what they're paying the pharmacy for the drugs. We want to make sure that that is a transparent process. Our concern when we talked throughout this process is that there may be a little bit of opacity in this process. We want to make sure that we have an eye making sure that the consumer, the residents of the state of Connecticut, are the ones benefiting. Same thing with the rebate transparency. Again, this is all about transparency. We're not saying that we are making every step forward at this point, but we're wanting to have a good view at what's going on behind the scenes. One of the discussions that we had in the task force is a shortage of some of the prescription drugs that we have. We are seeing this across the country. We bring in a lot of our pharmaceuticals from mostly China and India, and there are concerns when we have limited places where we are manufacturing our drugs. Sometimes we may have shortages. We have people in the state of Connecticut that can actually jump forward and help if we have shortages on any of the drugs. So this, I believe, the Drug Shortage Task Force, and then also looking at allowing for DECD to finance some of these initiatives when we talk about drug shortages. One of the most important things that I think we got into this bill is looking at compensation for pharmacists. We have talked about the issues with our pharmacies and our pharmacists providing care to the residents of Connecticut, and they're not being compensated for their work. During COVID, the pharmacies and the pharmacists stepped forward and got vaccines to many of the residents across the state of Connecticut. And guess what, Mr. Speaker? They actually do not get compensated well for this. We are putting a lot on our pharmacists. They actually do HIV, they do flu testing, and now we've asked them to go through courses to be able to prescribe oral contraceptives. But again, we are not compensating them for it. So when we're asking our pharmacists to step up and help the healthcare of Connecticut, we need to make sure that we have their backs and say, we're asking you to do this, but we're going to support you. So this looks at starting a working group to look at compensation for our pharmacists. One of the pieces in here that I think many people get a little bit iffy about is the Canadian drug importation study. And I am all about this. Everybody says, oh, well, they're not going to let you import their drugs. This is not about Canada. This is about the state of Connecticut. Can we open up the process to start looking at where we can get drugs into the state for a better price? And you know what? It's not going to be an open free-for-all. This is a serious process, and actually the federal government allows this process, and there is another state that is doing this as well. So this is just going to open up so there's competition when we look at bringing drugs into the state. I think that even if we don't get everything we want, even if this doesn't go all the way through, it's going to open up discussions for our pharmaceutical companies to say, hey, we think we should be getting a fair price on drugs too, and we can increase competition by adding this in. Mr. Speaker, I am really happy to stand here today in support of this bill, and I strongly urge all of my colleagues to support it as well. This has been a very pure, good process. This is what governance should look like. I urge adoption. Thank you.